Hello, I am Dr. K. Paul Stoller, and this short video asks the question why we are giving newborns the hepatitis B vaccine on day 1. Let's go back to 1990 when the Hep B vaccine first came out, and I was trying to understand why there was a recommendation to give a vaccine for what is essentially an STD to a 1-day-old infant. Even if the antibodies perform as advertised, which is rarely the case, those antibodies would be gone by the time that infant might be exposed to Hep B. Never mind, there are only about 200 women a year in the USA giving birth who also have chronic active hepatitis B. Of course, vaccine manufacturers can't make bank on 200 infants a year. The neonatal period is the first 28 days of life. The clinical study on this vaccine did not use newborns, and the so-called safety study lasted 5 days. That is hardly a safety study, that is just a study to make sure no one dropped dead immediately. Studies and product labels like Recombavax HB and Engerix B show the vaccine works after a full series, not just the birth dose. And when they say it works, they are referring to the fact that the vaccine causes antibody production, not that those antibodies actually protect. Trials start at 2 months or measure protection after multiple doses, not right after day 1. Oddly, no U.S. study tracks antibody levels a month after that first shot alone. So does that day 1 dose really help? Immunology says no. Newborns can start building immunity, but it's weak and takes weeks, plus boosters, to hit protective levels. Their T helper cells aren't fully mature, plus the aluminum in the vaccine carries a dose-dependent toxicity risk, yet we lack studies comparing day 1 versus later shots. What if we delayed the first dose to 3 months for babies of uninfected moms? Their immune systems would be stronger, boosting benefits and cutting aluminum risks. Not to some. MedPage, a big pharma rag, ran an article where experts push back, calling doubts about the vaccine nonsense. But with no direct evidence of individual benefit versus risk, the science leaves room for debate. Heck, this is just about selling the vaccine, and science wasn't even in the room to begin with. The data suggests a delay might be safer for most newborns. But in an uninfected infant, that vaccine has no efficacy. Why are we giving it at all, except to benefit those selling it? Those antibodies won't even be present when that infant becomes a nurse, firefighter, paramedic, prostitute, or IV drug abuser. What do you think? Hit subscribe for more health deep dives. Let's keep questioning together.